Dr. Sanjay Oak is an Indian surgeon specialized in field of pediatrics and laparoscopy. He was the former dean of the Seth G Medical College and King Edward Memorial Hospital in Mumbai. He is also an elected fellow of the National Academy of Medical Sciences, former director of medical education and major hospitals for Medical Colleges in Mumbai. He is a prolific writer in Marathi and a weekly columnist of great repute. Dr. Sanjay Oak was also the Vice Chancellor of the Padmashree Dr. D.Y. Patil Vidyapeeth, Navi, Mumbai, the CEO of Prince Ali Khan Hospital, Mumbai, and Aga Khan Health Services India. He was appointed as the chairman of the task force for COVID-19 in Maharashtra.
Dear friends, doctors in hospitals were perplexed by a refractory pneumonia, a pneumonia that is not responding to conventional antibiotics, a pneumonia that spread in an individual like a wildfire. You take a morning X-ray, the X-ray is clean. You take the X-ray of the same person in the evening, it just white clouded lungs on both sides. That was something that all of us experienced in these 19 months. So we were completely perplexed and not really understanding what was happening. But this all was the story of January, February of 2020. What happened to us? There was a medical student. She was completing her education at Wuhan in the medical college. Once there was shutdown over there, she took a flight back home to Kerala and she landed up in Thrissur. And she was the first patient who was identified on January 27, 2020, when this 20 years girl was admitted with a refractory pneumonia. Within 4 days, her RT-PCR confirmed that this is coronavirus. She eventually got well and was discharged by about 6th or 8th of February. But the entire medical team that was treating her got infected and developed refractory pneumonia. And then it spread. Then it spread in Kerala. Then it spread in Maharashtra. And we started getting our initial cases sometime in March. Still we were not clear. What are we looking at? We are looking at lungs which are showing those whitish patches which you can see there. Those are the whitish patches which you can see on the lung. They were absolutely pathognomonic. They were called as ground glass opacities. So the short form was GGOs. They were counted. They were assigned to the individual parts of the lungs and a score was evolved that if these are the number of GGOs, perhaps we are looking at a moderate case or a mild case. But still, the enemy was unknown to us. We did not have the RT-PCR facility except in Pune at NIV Pune. And the other center was Kasturba Hospital, which I had set up a level 4 lab when I was the director of Mumbai's health. But barring these two centers, we had nothing in the state of Maharashtra. Today, we have 537 centers all across the state where RT-PCR is possible. And in yesterday's emergency meeting that we had, and today evening we will have a semi-emergency meeting with Honorable Chief Minister talking to us right from his hospital bed. We are taking these labs to a next level because the existing RT-PCR facilities and the kits available will not be able to diagnose the absence of S gene, which is pathognomonic of B.1.1.529. So I'm making a plea to the government that don't look at the expense today. Provide those kits which will enable all the RT-PCRs in Maharashtra to pick up the absence of S gene, and then those samples can be subjected to genomic mapping to identify whether this virus is there, this serotype is there. So the enemy has been unknown. Very little scientific data was available. Very scanty information was coming out of China. And the symptoms were evolving. What do you complain of? You complain of cough, you complain of cold, you complain of sore throat, you complain of stuffy nose, you complain of mild fever. Well, if I ask, each one of you will put up your hand up and say that, yes, I at least get these symptoms twice every year. So it is as simple to begin with. It is as inauspicious, it is as innocuous as it looks. But that is not what it is. It changes itself into a more sinister presentation in the next 72 to 96 hours. And that rapidity of spread was eventually killing people. We had very scarce testing centers, as I told you, and the virology labs were far and few. Ventilators were inadequate, and high-flow nasal cannula, the machine that helped us in this pandemic, was available, but very, very little used by the medical fraternity till April 2020. Sir, I go back here to Mahabharata and Jnaneshwari. For the last 10 days when I was reading, I was preparing, and today when I was talking to Sanjay, there are eternal principles of Mahabharata which can be directly copy-pasted on the COVID pandemic. And I said that what was true in the Dwapar Yuga has come true even in Kali Yuga. Sir, when the pandemic started, our ICUs were full. We had patients in the hospitals on the bed, under the bed, in between the bed, in the galleries, on the stretcher, in the porches. World was not different. In UK, patients were examined in their cars and were stratified whether you need an admission or you don't deserve or merit an admission. In the ICU, we had our own relatives, our own friends, our own colleagues with whom we have worked. The worst part of this pandemic, dear friends, is that I have lost some of my best of colleagues in the medical fraternity. And that has been the plight of almost all of us. So you are in a perfect picture of Arjuna standing on the Kurukshetra and saying, Sidanti mama gatrani mukham cha parishishyati. I do not know how to treat, whom to treat. And it was at that stage that Krishna's role was important. And when Krishna tells Arjunas that your plight today is deplorable, you are working, you are acting like a timid, you want to drop down, you are all astrads. And if you exhibit such kind of a cowardice, you will never be remembered in the subsequent years to come with reputation behind you. So that kind of, if I may say, reprimand that Sri Krishna gave to Arjuna was required to the medical profession. And I must say, task force did that job. We gave that particular reprimand. So we helped the doctors and the medical fraternity to come out of what is called as a Vishad phase of Arjuna. Tell them that come out of emotional turmoil. Yes, we know that you are treating your own families and relatives and kith and kin. You know that you will be in the hospital for perhaps 2 days, 3 days, 6 days, 7 days. You will miss your children. You will miss your home. You will be staying away from them for weeks together. And perhaps you will yourself need psychotherapy. But this is your karma yoga. And execute today, come out of Vishad Yoga and execute your karma yoga. This is something that came from Mahabharata and Bhagavad Gita to our rescue in treating this particular pandemic.
समस्त बंधू भगिनी आणि वारकरी भाविक भक्तांनो, तत्वज्ञ संत श्री ज्ञानेश्वर श्री तुकाराम महाराज यांच्या नावाने आणि विश्वधर्मी प्राध्यापक डॉक्टर विश्वनाथ दा कराड यांच्या अथक प्रयत्नाने साकार झालेल्या या विश्वशांतीच्या घुमटातून भागवत वारकरी परंपरेचा हा ज्ञान विज्ञानाधिष्ठित अध्यात्मशास्त्राचा दिव्य संदेश संपूर्ण मानव जातीला सुख, समाधान आणि शांतीकडे घेऊन जाईल याचा आम्हाला विश्वास वाटतो. जगभरातील मान्यवरांनी गौरवलेला हा विश्व शांतीचा घुमट लवकरच जगातील एक आश्चर्य म्हणून ओळखला जाईल आणि भारताला विश्वगुरू म्हणून मान्यता प्राप्त करून देईल अशी आमची प्रांजळ भावना आहे.